Welcome back to Diabetic Foot Files. Today we're going to be exploring an overlooked but yet still fascinating topic, the foot-liver connection. So when we think about a diabetic foot ulcer, we often focus on the neuropathy, the infection, and the blood flow. But what about another organ, the liver, which is quietly significantly influencing wound healing, the inflammation, and your amputation risk? So, at first glance, some people may think the liver and the foot have very little in common. One sits on the upper abdomen, and the other one bears the weight of the entire body every day. Yet, emerging research suggests that liver disease, particularly metabolic dysfunction associated steatotic liver disease, formerly known as non alcoholic fatty liver disease, may play an important role in diabetic foot outcomes. The liver does have major influence on the wound healing. We always talk about albumin, other things, right? And what does the liver also store? Like glucose, right? Wound healing depends on adequate protein production, nutrient metabolism, immune function, blood clotting factors, and inflammation, all processes that are heavily regulated by the liver. Patients with chronic liver disease, cirrhosis, and severe fatty liver disease often experience slower healing, higher infection rates, and poor surgical outcomes. That's why we like looking at albumin. So, why does the liver matter? So, the liver is much more than a detoxification organ. It regulates your glucose metabolism, your lipid metabolism, your protein synthesis, your coagulation factors, your immune function, and inflammatory signaling. I wouldn't say a friend, somebody significant, but they had liver disease and it was very significant. And seeing their pictures and what they had to go through until they got an actual transplant was very eye opening. And, it honestly, I don't think people really understand until it happens to them. Important every organ to function properly means for their entire life. Just one organ dysfunctioning a whole ripple effect in your entire body. And in many ways, the liver acts like a body metabolic control center. So when the liver function becomes impaired, the consequences are felt throughout your body. Like I said, a ripple effect, including your lower extremity. So the liver is often called the body's chemical factory. While most of people associate with detoxification and those people who like eating liver, I don't know. I can't do it. I mean, to each his own. My mom loves eating litter. I just can't. The taste don't for me, but she likes the taste. But that is only, when it comes to detoxification of the liver, is one of more than 500 known functions of the liver. And nearly every major metabolic process in the body either occurs in the liver or depends on the liver. So let's do the one that most people know about, which is glucose metabolism. And what does glucose metabolism also depend on? Diabetes, right? So the liver is the body's glucose reservoir and the blood sugar regulator, and ensuring that the cells receive a continuous supply of energy regardless of whether you've eaten or not. So, what they call the fed state, this is after eating. Following a meal, carbohydrates are broken into glucose, causing the blood glucose levels to rise, and the pancreas releases insulin, which signals to the liver to remove the excess glucose from the bloodstream. And then the liver converts the glucose into glycogen, right? Glycogenesis. And they store approximately 100 to 120 grams of glycogen. And this prevents dangerous spikes of our blood sugar. And this converts the glucose into fatty acids when the glycogen stores have become full. And this protects our tissue from hyperglycemia. Now, during fasting, right? This is when the blood glucose levels begin to fall. The pancreas releases glycogen, and the liver responds to this by breaking down glycogen into glucose, glycogenolysis. Okay? I know I'm not pronouncing that right, but this releases glucose into our circulation and helps maintain our glucose level between 70 to 100. Okay? And this helps supplies the brain, the red blood cells, the kidneys, and the muscles indirectly with sufficient energy. Now, when we're having prolonged fasting, so after the glycogen glycogen stores become depleted. Typically, this happens after 24 hours. The liver begins go through glyconeogenesis, and this is a process where it creates new glucose from amino acids, lactate, and glycerol. And without gluconeogenesis, severe hypoglycemia can develop. So why does this matter? Because poor liver function can cause hypoglycemia, hyperglycemia, resistance, increased risk of type 2 diabetes, as well as delayed wound healing in diabetic patients. Now, another major function of the liver is it serves as the body's central lipid processing plant. So it regulates fat synthesis, storage, transport, utilization, and it controls virtually every aspect of cholesterol and fat metabolism. So when it comes to fat synthesis, when excess calories are consumed, particularly our carbohydrates, the liver converts the glucose into fatty acids. These fatty acids become triglycerides, cholesterol, and phospholipids, and some are stored while others are exported. Now, the lipoprotein production. So the liver manufactures lipoproteins that transports fat through the bloodstream. And these include VLDL, which stands for very low density lipoproteins, which these deliver triglycerides to the tissue. Next are LDLs, which stand for low density lipoproteins, and these deliver cholesterol to the cells. And excess low density lipoproteins contribute to atherosclerosis, which affects our heart, right? And our blood flow. And then HDL, which is high density lipoproteins. These collect excess cholesterol and return it to the liver for disposal, and this protects against cardiovascular disease. So, when it comes to our cholesterol regulation, the liver produces cholesterol, removes cholesterol, converts cholesterol into bile acids, and then eliminates eliminates cholesterol through bile. So, nearly 80% of the body's cholesterol originates in the liver. And when it comes to fat breakdown, like during fasting, the liver oxidizes the fatty acid for energy, and this helps produce the ATP and the ketone bodies. And ketones become alternative fuel source for the brain during prolonged fasting. Probably why I get dizzy. And wow, when we talk about fatty liver disease, when the fat accumulates excessively, this can result in hepatic stenosis, okay, fatty liver, aka fatty liver, inflammation, fibrosis, cirrhosis, and this is increasingly common in obesity and type 2 diabetes. So, when it comes to our protein synthesis, the liver is the largest protein producing organ and it manufactures many proteins essential for life. Like we said, albumin. We and wound care, we care a lot about the albumin levels, right? Because albumin is the most abundant protein in the blood plasma, and its functions include maintaining oncotic pressure, preventing edema, transporting hormones. We use it to see healing ability as well, to be honest, okay? Transporting fatty acids and binding to calcium as well. And low albumin leads to poor wound healing, ascites, and swelling. So, our carrier proteins, the liver produces these things called proteins that transport, right? And such as they transport things like iron, copper, thyroid hormones, steroid hormones, vitamin D, and fat soluble vitamins. And without these proteins, nutrients cannot reach their target tissue efficiently. Now, amino acid metabolism. So the liver converts amino acids, stores amino acids, and breaks down amino acids. And it also removes ammonium produced through protein metabolism. So with that, we have to think about the urea cycle. So ammonia, okay, is extremely toxic to the brain. The liver converts ammonia into urea. Urea is then excreted by the kidneys. The liver failure allows ammonia to accumulate, leading to confusion, memory impairment, hepatic encephalopathy, and coma. So always pay attention to those things, okay? Because I just wish certain people understood how complex the body is. Yes, we've been studying this for years, but understand what's going on with your patient. Don't just write it off and say, "Oh, they're just stressed," or anything like that. Because even, like, I had a family relative, unfortunately, they passed, but they were making really bad decisions in the end, close to the end stage of their life, and everybody's just like, "Oh, he's just headstrong, whatever." No, he had encephalopathy. That's why the certain things were happening, and I'm like, "Why didn't anybody just pay attention and not just listen to me?" But I'm just like, "This isn't normal. This isn't normal." But, whatever, side note. But as you can see, it's affected my life personally, watching people make bad choices and decisions when it comes to medical decisions when they had no idea what was going on medically. But you know what? Ignorance. Ignorant people I've noticed will have a lot more to say, especially like what happened another thing happened, they didn't understand what putting somebody on oxygen meant. It wasn't a nasal cannula, they were putting the person on life support, and you saying, "Oh, I didn't know," knowing that the hospital wasn't well-versed in that, they didn't have the resources to do that, and yeah, in the end, the person died. So, I mean, be careful when you're making certain medical decisions, and then make sure that you know that where you're sending your family relative is in to a very good reputable hospital. Not everybody has that what's it called again? Not everybody has that access, right? And that's why it's so important when it comes to the government, right? Playing a role in the general public's access to healthcare. That's why you hear me being so hard with what happened in my home country with how bad the government has been managing the healthcare system because it's deplorable. It's absolutely deplorable. I never seen the worst evidence of self-governance in my entire life when it comes to something like that. Because honestly, I keep on saying if you think this is well enough for the general public, I suggest you only go there too for your medical health care, and let's see if you get out alive. That's it. You know, if you think this is good enough for the general public, okay, where people are dying, they are misdiagnosing, they do not have resources, they don't even have enough gauze, okay? And you're going to a private doctor paying thousands of dollars because you want to stay alive, you shouldn't be doing that. If you're responsible, the government gave you a budget to, help the general public. If that's your job, health, right? You're the person responsible for the health and wellness of the people in that country, right? Why is it so bad? I've never seen it this bad, and I've been alive for 37 years. I've I've lived in the country until since I had to go to college. I've never seen it that bad, okay? Why would something with advanced technology, more money, why would something get worse instead of better? Because of poor management, most likely, right? Poor management, just giving anybody the job, not consequences for poor decisions, not saying, oh, why are all these people dying because of poor decisions? Then if you think this is totally fine, then you go there. I was reading an article. This is all on a side note, but these are the things that make me very upset. I was reading an article about a mayor who literally I'm not sure if it's once a week or once a month. He sleeps in the homeless shelter because he wants to see how the money is getting distributed for this program for the homeless people. And I'm like, why aren't the people here doing that? So you can't say you can't do it. Why are you letting people just die senselessly? And you can't say that you're doing your best because this is not your best, okay? This is not your best. And if you don't think you are well enough to do it where you can help people stay alive, okay, shuffle to the left, electric slide to the left out of the camera's view and go to work or give it to somebody you know who can stay awake, pull all-nighters and get the job done, okay? I know people say what? What do people say? People want results. Yes, people want results, but they don't want bad results, okay? And you're giving us the most of the bad results I've ever seen, okay? People are so scared to go to this hospital because it is a guarantee that you might die there. It is a guarantee, like 75 to 80% that you probably will die there because of how bad it is. I don't even know what they're teaching the people that they have a collaboration with. I'm like, why are people dying? Why do y'all not care? Why are they not getting audited about all the debts? And on top of that, they're betting on the general public being ignorant, not knowing that, hey, this is not supposed to happen. I know it's not supposed to happen because I worked in actual functional hospitals. I'm like, all of this is not supposed to happen. Majority of this is medical negligence and illegal, but they don't know that. They're betting on the general public not to know that. And they're honestly putting a less significance on the general public life. That's what they're doing. And I don't care who hears me or whatever. And if they're the person who's responsible, then fix it. Okay? Prove me wrong. Fix it. Save a life at the hospital instead of letting everybody die. All I keep on seeing is people die from this hospital, people die. And I'm like, what's the point of having anybody there if they keep on dying? They're better off going to a urgent care than going there because the people are negligent. They don't know what they're doing. They don't know how to diagnose. They just don't know anything. But that's a side note, but I don't think people understand how serious this is because life is irreplaceable. And it's annoying to know that somebody is in charge and they don't know what they're doing. I agree. You do not know what you're doing. That person does not know what they're doing. They don't know how to keep people alive. And I'm like, why are you here? Why are you even in that position of authority? How you get in a position of authority and you're still letting people die? That is crazy. And the fact of the matter is that there is no shame. That the person still will put their face on the camera while people are dying, and there's no shame that you are responsible, 100% responsible for every single person who has died in that hospital is because of you, because you didn't fix it. That's ridiculous. That's ridiculous that you have no shame in that. You should be ashamed of yourself, 100%. Be ashamed of yourself. You shouldn't be in the camera every single day, dropping your jaw, okay? Saying nothing. People want results. I don't want to hear you talk. Like I said, electric slide to the left, out of the camera view, and do the work or find somebody who will fix it better than you. Because the way you're doing it, it looks like a toddler, like we gave it to a toddler. Like who put the toddler in charge? A grown person, old. Who put the toddler in charge? They don't even know how to talk. It's the truth. But let me get back to foot and liver. But as you can see, it bothers me because it's annoying that they think the public deserves this. That's my biggest problem. You're thinking that the public deserve it. I can understand somebody admitting that these are wrong and that they're working to fix it. And I'm like waiting. I know it's going to take months, but watching somebody who's been doing this for 5 years and come back for another 5 years and it's still worse than ever, should be ashamed of yourself. 100% should be ashamed of yourself. And honestly, just because you know somebody shouldn't doesn't mean you need to hire them. Just because they're your friend doesn't mean that you need to hire them, okay? And honestly, like I keep on saying, prove me wrong by going there and only getting your healthcare there and going and letting all your family and loved ones only get healthcare there. Let's see if you get out alive. Watch them put an IV in you. Watch them just let you go. Okay? But okay, back to the liver. So, a liver, acute phase proteins. So, during infection and injury, the liver also rapidly produces proteins such as CRP. Remember, we care about CRP so much, especially in infections and diabetic foot ulcers, serum amyloid A, complement proteins, hepatoglobin, and fibrotin. These proteins help coordinate the immune response, right? Then another big thing when it comes to liver, clotting factors. Blood cannot clot properly without the liver. That's a fact. And the liver produces nearly all the major clotting proteins. That includes fibrogen, prothrombin, which is factor 2, factor 5, 7, 8, 10, protein C, protein S, antithrombin. What about vitamin K? So the liver activates several clotting factors, including vitamin K. So without vitamin K, blood clotting slows down dramatically and bleeding risk increases. Okay. And then balancing the clotting factor, the liver maintains an equilibrium between clotting formation and clot break time, which is fibrolysis. Okay. This prevents excessive bleeding and dangerous thrombosis. Now, when it comes to liver disease, many patients with severe liver disease may have easy bruising, nosebleed, gastrointestinal bleeding, intracranial hemorrhaging because the clotting factors production is declined. So when it comes to the liver, there is these special cells called Kupffer cells. Kupffer cells, Kupffer. And these are specialized macrophages that line the liver sinusoids. And they help remove bacteria, destroy fungi, eliminate viruses, clear parasites. Remember, there's a parasite thing going on right now that's been giving people diarrhea. So keep that in mind too. Remove dead blood cells and phagocytose the toxins. So approximately 80 to 90% of the body's tissue macrophages reside in the liver. So another thing the liver synthesizes is most complement proteins. Complement proteins, they punch holes in the bacterial membranes, recruit immune cells, enhance phagocytosis, and amplify inflammation. So we have to also know like how the liver affects each stage of our healing. Like I said, for hemostasis, it helps stop the bleeding, right? Because for the hemostasis phase, if you have liver disease, your clot formation will be delayed. The patient will easily bruise. Make sure to look out for that, okay? If you notice a patient might easily bruise more. Ask the right questions. Are you on a blood thinner? Certain things. Surgical wounds may bleed more easier. Debridement procedures may carry a more higher bleeding risk when a patient has a liver disease, okay? So, a stable clot is also the scaffold of which the new tissue begins to form. Now, when it comes to the inflammatory stage of wound healing, right? This is essential for clearing out the bacteria and the damaged tissue. The liver supports this by the acute phase proteins like CRP, complement proteins, fibrogen, and serum amyloid A. And these proteins help recognize the pathogens, recruit the white blood cells, enhance the bacterial clearing, and coordinate tissue repair. And when it comes to the proliferative phase, right? When it comes to rebuilding the tissue, remember, that's my favorite phase of wound healing, proliferative phase. But the liver provides many raw materials needed for repair. So the albumin, which is the most abundant protein, right? The most abundant plasma protein, forgive me, which help maintain the fluid balance, transport nutrients, deliver hormones, carry medications, reduce tissue edema. Low albumin is associated, of course, with delayed wound healing, closure, poor granulation, increased wound drainage. I had a patient and I was just like looking at the labs and I'm like, "There's so much albumin, like they're losing so much albumin." And it was because of the wound exudate. The wound was exudating so much because I had to change them every other day because the wound was so draining so much. They were losing so much albumin through that. And the albumin actually stabilized as the wound was getting smaller and smaller. But low albumin is also associated with longer hospital stays and actual higher infection risk and things like that. Like I said, higher, what's it called again? Wound exudate. Okay. And we already talked about lipid metabolism. Now, collagen formation. So, fibroblasts synthesize collagen to provide strength for tissue, healing the tissue. The liver contributes to this by producing the carrier proteins for vitamin C, copper, which supports the collagen synthesis, metabolizing the amino acids into building blocks for collagen, help regulating protein availability. And when liver function is impaired, collagen production decreases, scar tissue is weaker, and wound can remain open for longer. Now, angiogenesis, the formation of our new blood cells. The liver influences angiogenesis by producing the proteins that are involved with the vascular growth, regulating inflammatory mediators, supporting endothelial cell function, and maintaining nutrient availability. So, liver dysfunction impairs new blood vessel formation as well as reduce the oxygen delivery to the wound. And in our remodeling phase, which is a great phase as well, remodeling phase can continue for months, remember, months and even years after, right? And it helps regulate through collagen turnover, matrix remodeling, long term protein synthesis, and scar formation, maturation, forgive me. And patients with chronic liver disease may develop very fragile scars, delayed scar maturation, and reduced tensile strength of the skin, okay? So, why does liver disease also still delay wound healing? So, malnutrition plays a huge role. So, the liver stores and metabolize nutrients needed for healing, and liver disease can cause a lot of deficiencies, such as deficiencies in your protein, vitamin A, vitamin D, vitamin K, zinc, and iron. And these deficiencies impair multiple aspects of your tissue repair. And the chronic inflammation. Liver plays a role in the chronic inflammation, especially when it comes to a patient having the metabolic dysfunction associated stenotic liver disease, also known as MASLD, that creates persistent low grade inflammation. And the chronic inflammation states can cause increased oxidative stress, impaired insulin sensitivity, as well as delayed progression from inflammation to tissue repair. We talked about the edema, but now we have to think about the complications or the implications for diabetic foot ulcers. So patients with diabetic foot ulcers frequently have concurrent the MASLD. And this combination worsens your insulin resistance, increases systemic inflammation, reduces protein synthesis, increases susceptibility to infection, slows granulation, delays epithelialization, and prolong overall healing. So although liver disease is usually not the primary cause of a diabetic foot ulcer, right? It can be an important systemic barrier to the healing. And identifying and addressing the liver dysfunction, along with optimization of glycemic control, nutrition, vascular and infection management, and pressure offloading, can improve the conditions needed for our patients to heal. So, when it comes to the cytokine production, right? When stimulated by infection or tissue injury, the liver cells do respond by cytokines such as interleukin 1, interleukin 6, TNF alpha, right? And these trigger the production of acute phase proteins that help fight infection and support our tissue, right? And we already talked about that. But what is research has shown or statistics? Up to 70% of patients with type 2 diabetes have fatty liver disease. And these patients often exhibit insulin resistant chronic inflammation, endothelial dysfunction, as well as increased cardiovascular risk. That's why I say diabetes is not is not at all in any shape or form a simple disease or disorder. It is not at all. It affects almost everything. Everything is off balance, out of balance, okay? So when it comes to sarcopenia, we talked about that, but this is where liver meets limb loss. So one of the most fascinating emerging concepts is the relationship between liver disease and sarcopenia. So patients with chronic liver disease often lose muscle mass, strength, and physical function. I remember the person telling me how they were after they got the liver transplant and just holding themselves up with a walker was so extremely painful and took so much breath out of them. But sarcopenia has been associated, we already did an episode on it, increased diabetic foot risk, poor wound healing, increased falls, and reduced mobility. So, as clinicians, what should we watch for? When managing a diabetic foot ulcer, we have to consider, does this patient have a fatty liver disease? Have their liver enzymes been evaluated? Is their albumin low? Is there evidence of malnutrition? Is there sarcopenia present? Okay. What labs should we order? Or liver labs should be ordered for a patient who is in wound care with us, right? Selected patients, but not routinely for every patient. So you have to keep that in mind, okay? So I would order a liver function test when a patient has diabetes, especially poorly controlled diabetes. They have signs of obesity like a BMI over 30, metabolic syndrome, hyperlipidemia, hypertension, a persistent slow healing diabetic foot ulcer, recurrent wound infections, unexplained edema, low albumin, signs of malnutrition, long-term use of potentially hepatic toxic medications like prolonged antibiotics, methotrexate, amidrone, said that wrong, and valproate, and other chronic liver signs like jaundice, spider, angiomas, ascites, palmar erythema, or elevated inflammatory markers without any clear source, okay? Because the liver synthesizes all these proteins, clotting factors, immune mediators that are essential for our tissue repair. Liver dysfunction does contribute to delayed healing. So initial workup, you're gonna, when it comes to liver enzymes, I know this episode is a little long, but your ALT, the alanine transferase, LAT, right? So if it's elevated, it does suggest fatty liver, hepatitis, drug-induced liver injury, which as podiatrists were very associated a lot with the antifungals that we prescribe, especially if we're treating somebody with onychomycosis. So when you have onychomycosis and you want to test and you want to possibly prescribe the patient with the oral antifungal, because a lot of patients want the oral antifungal because they want something that's kind of like not fully guaranteed, but it's the most effective way, I believe. And they've tried topicals and they're like, I just want the oral you have to get tested with the antifungal before, middle, and after, okay? When it comes to your liver function test. And if your liver function tests are getting elevated while you're on that antifungal, most likely they're gonna have to stop, okay? Because it's causing you liver function injury. Now, when it comes to AST, right? That's showing liver injury, muscle injury, advanced fibrosis, and cirrhosis, possibly. And then your AST ALT ratio, okay? If it's less than one, that is typical MASLD, right? If it's greater than two, that is very suggestive of alcohol related liver disease. Now, ALP, right? Elevated ALP, and just look up the labs because I'm just trying to shorten this down so this wouldn't be so long, but it already is. But ALP, cholestasis, bile duct obstruction, infiltrative liver disease, GGT, okay, gamma glutamyl transferase, high levels indicate fatty liver, alcohol use, medication effects, and cholestatic disease, okay? And then other things like your hemoglobin A1C, your lipid panel, your prealbumin, which is transparent, okay? Although influenced by inflammation and not a perfect nutritional marker, prealbumin can help provide additional information about the recent protein status of selected patients. Okay. So when it comes to imaging, if they're worried about the person's liver ultrasound may detect stenosis or assess the liver morphology. Now, who do you refer to? Most likely the primary care doctor or the hepatologist. If the enzymes are elevated, sometimes they do, when appropriate, they will refer to a gastroenterologist. So liver disease requires further diagnostic evaluation, registered dietitian to help for protein and optimization, diabetes nutrition, MASLD, dietary management, endocrinologist. But from a practical wound care perspective, patients with diabetic foot ulcers, a reasonable laboratory evaluation, especially if healing is delayed and systemic factors are suspended, often includes CBC, CMP. CMP usually includes AST, ALT, and ALP, bilirubin, and albumin, okay? And you get your CRP, your hemoglobin A1C, and your lipid panel, and your prealbumin if nutritional status is a concern, okay? And key takeaways from this episode, I want patients to understand one of the big things y'all know I'm all about equality when it comes to health, high quality healthcare for everybody. That's one of the biggest key takeaways and hold people accountable when you see that they're just abusing their power and not helping the general public. And you know what? Get a taste of your own medicine. Go to that hospital, you get treated. Let's see if you have come out with an obituary or not. How about that, right? Another key takeaway, sarcopenia links liver disease to poor diabetic foot outcomes. Successful salvage may require treating systemic disease, not just the wound itself, but I think everybody knows that from this episode and from all the episodes. Liver dysfunction may worsen inflammation and impair wound healing. Fatty liver disease is extremely common in patients who have diabetes. These are the key takeaways I want people to understand. And the liver regulates your metabolism, inflammation, nutrition, and immune dysfunction. In closing, a diabetic foot ulcer may appear on the foot, but its roots are far beyond the foot, far beyond the lower extremity. And sometimes the wound is simply not a foot problem. It never is just a foot problem. That's one thing I always tell people when you see diabetic foot ulcer, it's the surrender flag. Okay, the diabetes has overcame the person's body and their metabolic system. It's that bad where there's a hole in the bottom of the foot that's getting infected and a skin breakdown, okay? Because why do you think you don't see really little babies having like diabetic foot ulcers, right? Why? Because they step on everything, they get little cuts and everything, they heal incredibly fast, right? But with diabetes, your immune function is functional. The healing, the cascade is dysfunctional. Everything is a little bit off balance, and it just causes this huge ripple effect. So we always have to remember that it's never just a foot problem when it comes to a diabetic foot ulcer. That's the problem. That's the end of it. It's never just a foot problem. Don't ever just think it's a foot problem and off you go. Let me offload, treat the foot, antibiotics, debris. It's never just a foot problem. It's a whole body problem that we have to fully address because we're trying to avoid the recurrence. We're trying to increase the longevity of the patient life. We're trying to increase the quality care of our patient. Okay. So in the end, although the liver is widely recognized for detoxification, the broader role is maintaining metabolic hemostasis, and it continuously regulates your energy production, your fat handling, your protein synthesis, your blood clotting, your immune surveillance, as well as inflammatory signaling. Because these interconnected functions, the liver health has profound effects on diabetes management, cardiovascular disease, infection control, and wound healing. And a healthy liver is simply not just a detox organ; it's actually one of the most vital organs and regulators of the overall physiological balance of the patient. So I hope everybody liked this episode of Diabetic Foot Files. I'm Dr. G. This is where we decode science, preserve and save lives one foot at a time. I apologize for my little sound rights, but it is a big problem when things like this happen. When you see the general public is literally dealing with the consequences of somebody else's bad actions. Everybody deserves quality care, healthcare, and a good quality of life. And they shouldn't be subjected to poor healthcare and their life being jeopardized because of somebody making very poor decisions, like a person in government, because just because they're just I wouldn't even say lazy. It's either lazy or ignorance. I don't know which one it is, but I'm thinking that it's laziness now because if the public is speaking up, people making articles of this is what happens, trying to suing and saying all these different things that are happening is and you're the thing about it is you're normalizing the general public to accept poor health care. Absolutely not. Okay? Absolutely not. And like I keep on saying, that person should be ashamed of themselves. Okay? For allowing the general public to get normalize something like this, to be like, that's all y'all have because y'all don't have money to go to a private hospital, put 4,000 down just to be registered at a private hospital. So y'all just have to go with the wind. Y'all, I mean, honestly, like I said, you're better off going to a urgent care sometimes because the hospital is so bad, unfortunately. Okay? And if it's not so bad, why don't you go there? The person in the government, why don't you just go there and let's see how well they manage you, you know? Because if it's not good enough for you, why is it good for the people, right? If you're going to a private doctor or a private hospital, if it's not good enough for the people and you're responsible for where the budget money from the government goes when it comes to that for the general public, if it's not good enough for you, why is it good enough for the people? Okay, one band, one sound, right? And the people are the one who voted you on to the band, okay? And you're just letting them down. You just literally got their vote, stole their vote, faked their vote, okay? You literally pretty much lied. You masquerade and lie. And then the moment you got the vote, got the position, you just said to the wind with them. I don't care if they live or die, they're the general public. That's what it seems like. Because if you did care, you would have done something by now. And you're not doing anything. And I'm telling the truth, you're not doing anything. People are scared to go to this hospital. So maybe another way you could show people that this hospital is good is you go there, get your nice little IV, get treated for a week, and let's see if you come out alive. Okay? If you get sepsis because they don't even clean that place properly, they didn't have AC for the what's called again, the ORs, but you have AC in your office. This is crazy. I've never seen such an abusive power in my life, but that these are things that I care about because I don't think the general public deserves that. They deserve much better than that, okay? It should be a privilege. If your country is run properly, it should be a privilege to be part of the general public. It should be a privilege. You should be able to go to a really great hospital and be like, wow, I know for a fact I'm taken care of because life is a general right. It's a basic right of a human being, the right to have life. Okay? and you're taking that person right away when you're literally subjecting them to a hospital that has funding, but you funded it wrongly. It should never go to your pocket. I should never see any renovations in your house. I should never see you even flying until, or even going on any trips until you fix the hospital. Fix the hospital. Okay? That's it. My public deserves better. And this is Dr. G. Bye.